Okay, so still on answering question in interviews, I'm not sure whether these are actually answered, question or actually answered this way, but there will always be some questions that are a bit of dilemma kind of thing, a bit hard to answer kind of thing. Have you encountered any of these questions, and if so, how do you answer them?
I should be asking you guys this question, actually.
Yeah, have you?
Well, I think the dilemmas are very common in clinical practice, right?
Yes, it is.
So it's all about how you reason and what is the reasoning that you're demonstrating to whoever that is assessing you. Yeah, so you may approach it from ethical perspective, right? Knowing some ethical principles, or you may take a different approach, like a sociological approach, I don't know, or even a religious approach.
Okay.
But as long as you have some kind of, we say that it's not just ethics, right? It's also morals, right? So if you have some kind of moral, if maybe you're not ethically so strong, or you have a good morality, a moral approach, I think that's also acceptable.
So let's just break that down for the audience. Ethical principle. Could we talk about ethical principle? What are the principles that you think the audience should learn when they go into the interview?
So ethical principles in medicine, generally we have a few.
Yeah.
We have non-maleficence, right? So we don't want to do harm, okay?
Yes.
We want beneficence, so we want to do good for the patient if we can.
Yes.
Then we have, we want to make sure privacy, confidentiality, right? We want to autonomy, so which is to respect the patient's right to make their own decision for themselves, and then what else?
These are the main four.
These are
the main four. Yeah.
Of course, there's also fiduciary duty, so you should make decisions in the patient's best interest.
Yes.
Right, and be honest whatever happens.
Right. Yes. Yeah. So that's one aspect of things. Morally, as you said, can be religious at their own conscience.
Yes, correct.
Right. Yeah. So since you were talking about that, right? Ethically speaking, so let's think of one difficult one and see how you answer.
Now I'm back in medical school.
okay, I do first because I've never done any medical interview.
Okay, you should try it with
the
assessor. The assessor.
Okay. No, you throw the question at me.
Okay,
I want to be the
Okay, so given the COVID pandemic, right? There are many things said in the social media about the COVID vaccine. If you face a patient who is elderly, who needs the vaccine, but is unwilling to, how would you approach this?
Thank you very much, Dr. Leong, for the question. So your question was, facing during the COVID pandemic, if a person or elderly person who does not want to take vaccine, but the vaccine is good, how would you approach it? So in my understanding in Singapore, vaccination is mandatory.
No, it's not mandatory.
Oh, isn't it?
No, it's not.
I failed already. But mandatory for travel.
No, even then it's not.
Yeah, it was.
During that, it was.
Yeah, not now. But you're talking about during the pandemic or now?
No.
COVID vaccine is so the person would have been vaccinated already at this time.
Yeah,
completed 3 or 4 cycles.
About 3 years
right,
ago.
So currently,
it's not updated.
But it's recommended that every 6 months or every year people
right.
get a booster. So
That's right.
If the person doesn't want, I would follow the ethical principle and ask the person what is his or her understanding of the safety and the benefits of the COVID vaccine.
Right.
I will give them the pros and cons, whether you take it or not take it, what are the disadvantages and what are the advantages.
Right.
Of course, cost.
It's free.
It's free.
It's
correct.
free.
Correct. And then I will ask on balance, I will not force the issue, because if I have given him all the information about the vaccine, he or she chooses not to based on his autonomy. I have done my job, provided that, of course, I told him follow the principle beneficence and non-maleficence.
Right. Okay. So do you think John passed?
I think it's a good attempt.
Oh no.
It's a good attempt. Yeah. I mean, you mentioned some of the key ethical principles, right? Beneficence, non-maleficence.
And this feels like Miss Universe contestant questions, you know.
Harder than that, actually.
Yeah, right. You know, here are final 3 contestants. They ask you questions.
That one is easy. To just talk about world peace.
World peace.
This one is
yeah.
a lot harder.